We wanted to develop a relationship with the community. At the time, I think we felt that services were more geared towards those who could afford insurance and payment. As a small clinic that we were, it sensitized students to needy populations. People have carried that on forward and I think influenced everybody that has come in contact with it.
When I started anyway, there was only a clinic with 4 rooms in it, and now we're, in about 13 different sites.
Being able to serve the underserved is a big deal, and so have those opportunities, even indirectly as an architect, are important for us.
Just the opportunities that we have to provide health care to so many that would never be able to receive any at all. There's just a huge need, and it's not going to go away.
Cataracts are common. Pterygium, which is a growth on the surface of the eye, is another issue. We infrequently see glaucoma. We see a lot of diabetic patients who may develop diabetic eye disease.
Pues me dio miedo más que nada dejar a mis hijas solas, porque pues yo nunca me cuidé desde un principio. Y mi madre pues murió de diabetes, pero ella murió en México. Entonces pues como yo me descuidé mucho, no me daba cuenta de nada o no me quería dar cuenta de nada. No saber preguntar a las gentes indicadas para qué tipo de ayudas hay o cómo puedo hacer para estar sano.
There are a number of patients who come to us intermittently with various issues for eye care. Some of them only need medical treatment, but some of them need surgical treatment.
The biggest roadblock for the OneWorld patients that I see is the facility fee, because we're able to do their surgery for them without cost, but the problem is the facility at an outpatient surgical center or at a hospital, there are hard costs that need to be covered. Gloves, drapes, antibiotics, things like that, and I see that as the biggest issue for patients.
Nada más yo, como le dije al doctor Pire, que fue el primero que me vio, que nada más veía yo una gota transparente. Me dijo él que me iba a dar 8 sesiones de rayo láser. O sea, y fue cuando empecé con el rayo láser primero, y entonces decidió el doctor Pire mandarme con el doctor Prulo, que es el que me empezó a revisar la retina, y es el que me dijo que ya tenía un glaucoma muy avanzado.
I wanted to try and figure out a way to be able to offer free cataract surgery. If we had surgeons that were willing to operate, if we had a location that was willing to donate the time and the resources, that we could make that happen.
Without OneWorld, we may not be able to reach these populations. They aren't the typical patient that comes in through the door or, in to see a doctor and make an appointment.
The primary care doctor at OneWorld sees someone has an issue with their vision, Dr. Schlichtemeyer, who then screens the people, does an exam on them, and then makes a referral to one of the doctors that have volunteered to do their surgery.
Some of the patients who come in to see us are actually legally blind. They cannot see the big E on the eye chart prior to seeing us. And after removal of their cataract, many of them are able to see excellent.
We provide these patients with better access to their daily life skills, reading on a computer, reading a book. The quality of vision after they receive a new lens in their eye is, from my experience, amazing. It just,
Pues la verdad no sabría yo qué decirle a una persona de lo que es OneWorld, ¿verdad? Sí, porque he recibido mucha ayuda de aquí, de todos los que me han ayudado, doctores. Yo no los conocía y pues ahora son muy amigos míos, los considero así, ¿verdad? Y pues, no sé, me han ayudado mucho que pues siga mi vida normal.
I had been given a tremendous gift, a tremendous skill, and not something to be hoarded, but something to be shared with the world.
It's a great lesson in community development and compassion. And in my estimation, it's a small thing that I do, and it's a big thing for them.
When I saw what the clinic was and what the clinic has become, I was as surprised as anybody, that humble clinic, and now the scope, and gave me the feeling of, I couldn't explain it. Milagro.